This is looking at practically how to teach 4 students who are second year students how to do a practical activity. I'm assuming that the students have had a little bit of anatomy and physiology and a little bit of rhythm training in their first year. What I would do normally is I would send to the students a week or so beforehand what will be coming up in the week ahead, so that they can prepare if they want to. And for example, if I was going to teach them some echo views, this is their second year, some echo views and what we expect to see on an echo when we put the probe on the chest, I would start firstly with something like a heart model, and I would move on to the virtual TTE, a computer-based web application which can show students the chest and where the heart lies in the chest, and they can reflect back on that after the session and look at the views and where the heart's orientated in the chest. And then we would move on to the practical components of, I would take a student first as a model, and I would show them how to manipulate the probe to get that acoustic window where we can get the obstacles such as the ribs and the lung out of the way and create an acoustic window. So firstly I talk about the structures of the heart, so what is attached to what, the great vessels coming into the heart and going out of the heart, and I'd show them on the heart model what things are attached to what and what we'd expect to see in certain parts of our echo scan in relation to where the heart lies in the chest. So we would talk about this for say 15-20 minutes, and I'd encourage lots of feedback, lots of questions. I like to encourage the students to be curious at all times and to ask questions and not to feel that they can't ask questions. Once we talked about the heart and what structures are attached to what, we'd use the virtual TTE, which is a really useful web application to look at where the heart is structured in the chest, where it sits in the chest, sorry, and we could take the rib cage away, we could look at it without the rib cage, and we can see, this is the parasternal view, what our slice would look like when we were taking a parasternal long axis view. And we can also look at it with labels. So what we're looking at here, when we see the anatomy, we can see it with labels, so they can see what it would look like and what structures are what in relation to the location of the chest, the location of the heart in the chest at this particular point where the probe is. So I find this a very useful tool, and we can do that for all views, and we can rotate around, we can have a look at the slice, we can remove the rib cage, and then we can also look at different views here, any views that we choose to look at, which will also show where the heart is anatomically located in relation to where our probe is. I won't load those up because they do seem to take a long time to load up, but this is an application that they can also use after the practical session, and once they've had a chance to try and manipulate the probe on the chest, they can go back and reflect on this later. So then after we've done these two things, I would take one of the students as a model, and I would teach the students, I think what's really important is ergonomics for a student. You need to teach them early to have a really good position on the chest with so you can anchor your hand and your elbow and keep yourself straight, and keep the patient orientated where you can get the lungs out of the way and the ribs wide open, and then we can talk about how to manipulate the patient to get the best possible acoustic window. Then we will talk about the probe manipulation and just those gentle movements, the finite movements, which are very difficult when you're a junior sonographer, to just gently manipulate the probe to get the best window, to get deeper, to get shallow structures as well. So they're the sort of things that we would practice, and then I'd split the two, the students up into groups of 2, and then I would come around and help them to manipulate the probe and to just learn those finite movements. So that's how I would do this practical session for these students.